Many women face a daily painful condition known as vertebral compression fractures. It's associated with osteoporosis. With more on the symptoms and how to treat this is North Shore neurologist Dr. Chad Domingue with some answers for us. Thank you so much for joining us.
Always a pleasure. Good afternoon. Excited to show off some more toys.
Okay, so what exactly is this and who does it impact the most?
So when we're talking about compression fractures, we're talking about the building block of our spine. These are the vertebral bodies. We've talked about disc before being the shock absorber, but the bone is actually what allows us to maintain upright. The most common patients that get this, as you alluded to, are females with osteoporosis. It's actually pretty prevalent. 1 out of 4 females above the age of 65 have compression fractures. If you get to an 80-year-old, it's actually up to 40%. Other things that can cause compression fractures are people that take chronic steroids for other disease processes or trauma. But what happens, and I brought a marshmallow to give the viewers an analogy, that hard bone becomes very soft, so the top and the bottom of the bones start to compress together, causing the patients to kind of lean forward, and it can be very, very, very painful.
So talk about the symptoms and the best treatments for this.
Yeah, when you have a compression fracture, most patients say they feel it immediately. It's like an immediate pain in the middle part of their back. When we talk about treatment, you always want to talk about prevention first. Vitamin D, calcium supplementation, but you got to make sure you're taking the right stuff. Also weight bearing, so bodybuilders don't have this as much. The procedure we're going to talk about today is called a kyphoplasty. And what we do with a kyphoplasty is we have a drill that actually goes into the bone, and once inside the bone, we pull it out, we apply another trocar into the bone that allows this device here, which is an inflatable balloon, and you can see how this balloon inflates. And once that balloon is inside of the bone, it pushes that soft bone to the outside, and it creates a cavity, which we then fill with concrete, actual cement, making the bone hard as it was before the fracture.
And recovery time for this, for those who suffer from this and who may want to know how long they'll be off of their feet, so to speak?
Yeah, so here's the great news. When we do these procedures here in my hospital, Cypress Point, we do it in a cath lab where they do cardiac procedures, and we use 2 x-rays. We can actually do a kyphoplasty in like 10 minutes. And they go home that day, and many patients actually feel pain relief immediately because the bone is now stable where it was fractured and unstable going into the procedure. So no restrictions, back brace maybe for a couple of weeks, but it's immediate instant gratification type of procedure.
Sounds good. Thank you so much for shedding light on that. Always good to hear that there are ways to get rid of the pain that so many people deal with on a daily basis.
Yeah, absolutely, Liz. We're going to have to find new subjects. I'm gaining too much weight eating all these sweets.
All these
donuts, marshmallows. We got to move on to something new.
Yeah, you're eating all the props. Okay, thank you so much, Dr. Chad. Appreciate it.
Absolutely. Always a pleasure.